I'm just getting myself set up over here, so don't worry. All right, here we go. Hello, thank you for taking the time to watch this video. We're excited to share with you the journey of a cross-sector partnership to align efforts for advancing health equity. You will hear directly from the partnership organizations and learn more about their powerful story. We'd like to take this moment to the team at NACHC and AAPCHO would like to acknowledge the Robert Wood Johnson Foundation for their generous support of our program and efforts to showcase the impact of community health centers and cross-sector partners. My name is Eureka de la Cruz, and I'm part of the team at NACHC and AAPCHO that work together on this program funded by RWJF. I had the privilege of working with the Purple team, and you'll hear more about them. And I would like to briefly, my name is Eureka de la Cruz, and I'm part of the team at NACHC and AAPCHO that work together on this program funded by RWJF. I had the privilege of working with the team, and I would like to briefly provide some background information before you hear from them directly. So just wanted to provide a bit of context. In the fall of 2020, our team recognized the challenging moment community health centers and cross-sector partners were in as they cared for their communities during the pandemic. We wanted to support the work they were already doing and meet them where they were at in their respective journeys. As a result, we wanted to use a design sprint framework to do just that. I'd like to take a moment to provide context in sharing our guiding why in developing this program. Our country is at a critical juncture with the global pandemic, racial reckoning, and economic downturn, catapulting the need to identify the policies and structures that create health disparities across our communities. It has long been known that racial and ethnic groups, as well as special populations, are most impacted by structural racism and systemic discrimination. As communities respond to and rebuild from COVID-19, there's an opportunity before us to drive systems-level transformation to ensure all communities are healthy and thriving. A design sprint cohort is a short burst of facilitated training and technical assistance with peer-to-peer learning focused on cross-sector collaboration and creative problem solving. Moreover, the design sprints will create the space and structure to facilitate cross-sector collaboration, data sharing, and analysis, as well as gap identification within health equity and continuous process improvement. By leveraging SDOH data, design sprints can foster strategic alignment between health centers and their health and human service counterparts, including community-based organizations, public health departments, and other social service providers. Through a human-centered design thinking approach, NACHC and AAPCHO created this space to catalyze local community partnerships that can use data-driven strategies to manage complex patient care, prioritize patient health needs, and collaborate on upstream courses of action that improve and sustain health equity. Our design sprint focused on RWJF's Theory of Change Alignment Framework, which has 4 pillars centered on shared purpose, data, governance, and finance. The framework also acknowledges that community voices, equity, power dynamics, and trust greatly impact and inform cross-sector alignment. During the design sprint cohorts, 4 cross-sector community teams were selected to participate in 4 different cohorts. Each cohort was comprised of a 3-month-long design sprint process, including sharing of best practices and training and technical assistance. Each sprint focused on building partnerships and stakeholder-led strategies consistent within the domains of RWJF's Theory of Change Alignment Framework: shared purpose, data, financing, and governance. So now I have the privilege of introducing you all to the amazing team that I worked with over the first cohort back when we started in February. I'd like to introduce Joe Grilly from Telespond, as well as Jen Walsh from the Wright Center for Community Health.
Hi, everyone. I'm Joe Grilli. I'm the president and CEO of Telespond Senior Services. We've been providing services to seniors in Lackawanna County since 1974, operating an adult daycare center, personal care in-home to our clients, and also administering the Senior Companion federally funded program. I would like to now introduce one of our other partners, the Wright Center for Community Health, and Jennifer Walsh of that organization. Jennifer.
Hello. I'm not sure that I see my video, Yuiko, but should I just keep going?
I see you. I'm able to see you. Yeah.
You see me. Okay.
Yeah, Joe, if you can go on mute and just turn off your video, that would be great. Thank you. All right, go ahead, Jen.
Hello, I am Jennifer Walsh. I'm the Senior Vice President of Enterprise Integrity and the Chief Governance Officer at the Wright Center for Community Health, which is a federally qualified health center lookalike, and also of the Wright Center for Graduate Medical Education, which is an independent sponsoring institution of ACGME accredited primary care residency programs and fellowships. It is an incredible honor to have participated in the Robert Wood Johnson Foundation Design Sprint led by NACHC and AAPCHO. And we have 4 incredible community partners, including Telespond, whom you've just met, led by Dr. Grilli, the Lackawanna County Area Agency on Aging here in Northeastern Pennsylvania has been one of our longtime partners as well, led by Jason Kavulich. And another critical partner here in NEPA is the United Way of Lackawanna and Wayne Counties, led by Gary Drapek and Peg Kopko. And together, the 4 agencies came together for this incredible experience, and we're thrilled to be able to share with you some of what we've learned. So one of the incredible benefits of the design sprint experience for our group was the real opportunity to come together in a safe space to talk about expanding what the Area Agency on Aging has led thus far, which is called our Aging Cooperative. And what we were interested in doing was bringing together our respective agencies and the various services that we provide to figure out how we can move toward whole person care for our seniors and their caregivers in some instances that will really help to promote their safe, independent living at home. So community-based care. This is a picture of Anne. She's one of our patients. And this is an example of how we were able to come together in a collaborative way to help Anne age safely in place at home. And so Anne's house had a bathtub with the 2-foot step to get over in there. And so United NeighborWorks and the Area Agency on Aging came together with us, and we were able to go in there, and they gave Anne a whole new bathroom with sort of a 0 entry shower. And they also made it in pink because that's what Anne wanted. And she was thrilled to have that gift. And she's so proud that she's able to stay home. And that's just one of the ways where our connections with each other was helping Anne to do what she really wanted to do in a way that was in her best interest, but also safe. So it was our goal for all of our agencies to come together to optimize our connectivity, to figure out again, a safe, neutral platform, how we can force multiply what we're doing for the benefit of our seniors. You can see some of the challenges and opportunities that we were able to together identify during the process. And, unsafe housing is a big one. Social isolation was another very key social determinant of health that the Area Agency on Aging has been really focused on. And we as medical providers and Joe Grilli and the Telespond team as daycare and social service providers, we're very interested in helping seniors to get connected so that we're attacking that social isolation. We also learned that there is a lack of cultural sensitivity to our seniors and the age that they grew up in, what they're expecting. I can give you an example that's probably most prevalent on our minds during the COVID-19 pandemic when the governors of various states issued phases for people to be vaccinated. And, you know, the seniors were just sort of waiting their turn for their phones to ring for that vaccine to come to them. And they weren't lobbying or advocating for themselves to be put at the top of the list. We need to take that on. So it's one of those things where we really need a cultural awareness of the mind frame of our seniors so that we can help them to feel respected and heard and give them empowered voice. And so the daycare services and the in-home services that an agency like Telespond provides are very important in that way. So again, these are sort of the challenges and opportunities that we together as a team identified during the process, and then moved on to try to figure out how to make something work in a shared vision. Next slide. One of the ways that we started our conversation as a team and trying to flush out our vision had to do with simply identifying the services each one of us provides. That gave us visibility into opportunities where we could connect dots together. You know, there's also always in social services funding struggles, and particularly during the COVID pandemic, which changed the way many of us work every day and changed our lives. It also changed the lives of seniors. And, you know, Telespond was in the middle of that and really trying to figure out how to get the workforce to continue to provide services when they were told to shut down. So, you know, Telespond, we're very fortunate in our region to have Telespond. Those services are very critical to the patients that we serve. And so we wanted to help make sure that Telespond could sort of preserve their legacy and grow so that they can become independently sustainable. One of the things that the Wright Center was in a position to do was to seek and receive a grant from the All One Foundation in order to try to make that happen. So creating this geriatric center of excellence, figuring out what is the business model for financial sustainability, but we couldn't do that really without the shared vision and the shared metrics of success. And this Robert Wood Johnson Foundation platform gave us the opportunity to come together and do that. It's really incredible. Next slide, please. So why did we do this with partners instead of by ourselves? We're always better together. We're a health center. So if you are a health center watching this webinar, you know what I mean. We are always better together, and our social service partners are really helping us to provide whole person care to the people we serve, and we're all serving the same population. So, you know, having the opportunity, the privilege really of participating in the design sprint gave us the opportunity to bring together like-minded organizations in a safe platform where there wasn't a hierarchy of ownership. We were all in it together, or equal partners, and to really share the vision and come to a place where we agree that we all have something to give and we all have something to gain. So it really highlights collaboration and the value of what that can bring to our populations. Again, I mentioned the All One Foundation. We are incredibly grateful to the foundation for supporting this initiative. We have a higher demographic of seniors in Northeastern Pennsylvania than in other areas of the state and of the country. And so it's an quickly escalating, increasing population, and we need to be ready to do whatever we can to support the social and economic determinants of health that are experienced by seniors, such as senior isolation, such as transportation challenges, such as daycare, caregiver shortages. We need to kind of be all in this together to promote the health and empowerment of seniors. Next slide, please. Enhancing our commitment to shared purpose. I'm sorry, I have to say that again. Okay, cut, Nalani. Okay, let's try that again. Enhancing our commitment to shared purpose. So when we say that our goal as a region is to create a regional geriatric center of excellence, you can't do that by one organization, right? It's going to take all of us. So breaking down those barriers and those silos of referrals and, you know, and funding sources and programming, and worse yet, because of the funding constraints that have been kind of ongoing in recent years, social service agencies are finding themselves in a competitive place. And we don't think that competition is the solution. We think that collaboration is the solution, and a cross-sector collaboration is even better. So we proudly came together with the Area Agency on Aging, and Jason Kavulich did a great job with his team of already developing a fairly comprehensive aging cooperative, which was basically a sketched outline of the other agencies in the region and how we can all work together. We took that concept and we embraced it in terms of what we do as a health center, which is we added specifically a geriatric service line. And what that means is that we needed to create clinicians who are sensitive to the needs of seniors specifically. So in partnership with the Wright Center for Graduate Medical Education, we developed and launched a geriatrics fellowship. And we were very fortunate that HRSA was able to fund 3 geriatric fellows right in the nick of time when we needed it the most. And so one other demonstration of how our partnership as health centers with HRSA is so community needs responsive, right? So we're very grateful for our partnership with HRSA. And that geriatric fellowship dovetailed with our geriatric service line launch, and then also our sort of embodiment of the 4 M's. How do we create an age-friendly health system? So we took sort of models from the IHI and models from Loma Linda, and we were kind of putting them all together to create a workforce that is sensitive to the needs of seniors across the adult continuum, not just as a geriatrician, but as an internal medicine physician, as a psychiatrist, as a family medicine doctor. And we wanted everybody to kind of share the same learning. And then our geriatric service line is now connected to Telespond. And so we have our nurse practitioner working with Joe's team and creating really specific surveys and assessments so that we're moving in that direction of shared metrics and how do we move the needle on our successes, and really then connecting back with the Area Agency on Aging as they're doing their assessments and figuring out what their needs are for the region. So really having that opportunity to get together and come up with solutions that we're going to measure ourselves, we're going to hold ourselves accountable to by each other, is really going to, I think, take us to the next level. So clarifying who can do what to avoid duplicating services and for accountability purposes. And then, of course, again, I've said it 3 times, so forgive me, but, whole person cares where it's at. That's where we're going. It's where we need to be going. The governor in Pennsylvania over the last year sort of announced to all the stakeholders that that's where you better go. That's where I expect you to go. And again, in Pennsylvania, the Department of Human Services is where Medicaid services live. And, our Commonwealth is even leveraging our MCOs and calling them to lead regional. There are 5 regions in Pennsylvania now for this program, regional conversations with other social service and medical providers about how do we improve the health of our region. So there's a lot of work in this area already being done. We're in it. Telespond and the Area Agency on Aging and United Way, our partners, they've all been owning this. And I think together we are going to make really great strides in this project. And I'm really looking forward to being able to share what those metrics are in the next year or so. Next slide.
Before we move on, Jen, if you can be mindful of your hands, there's times where you're touching and I can hear it. So
it's my pen. I'm sorry.
That's okay. That's okay. I just wanted to give you a heads up before we move on.
Thank you.
Sure.
So how are we encouraging community voice, engagement, and commitment in the projects that we're doing? So as a health center, you probably know that our board of directors is comprised, at least of 51% of them are patients or users of the health center services. And in our case, that number is actually closer to 90%. So our board of directors has been very engaged in and supportive of this project and our work in the geriatric service line and with the geriatric fellowship. We also have engaged our board members to provide input into the workforce curriculum that is specific to certain subject areas. So for example, we have a specific committee that will be hosting what we call PEP talks, or patient education provider talks. And so the patients are able to provide input into the curriculum of the geriatrics fellowship. What do they think the patient wants the provider to know, right? So that's a really interesting sort of innovation that we're excited to pursue and see where that takes us. I mentioned earlier that Telespond is working with the Wright Center on creating very specific shared assessments. So we're asking consumers and surveys, like, what do the consumers want, and the family members of consumers, and what do they need? That's very important to listen. Like we've learned, that's another thing I think that we've learned through this process, is the importance of listening, not just to one another, but to the people we're trying to serve. And then, of course, Joe's got this amazing program called the Senior Companion Program, where seniors are able to sort of volunteer almost to go into the homes of other seniors who do not have the ability to get out as frequently. And they kind of are attacking that social isolation problem, and just some incredible opportunities to do more there by listening to what our patients and our consumers and our clients and their families need. Next slide. So how do we sustain the cross-alignment relationships that we've been building over the last several months? So, the design sprint has the 4 different cohorts, and, the vision cohort was the first in the series. That was probably the most critically important for us, because we really needed that safe space to come together without judgment, to listen to one another, to whiteboard opportunities, and to develop the trust that organizations need to really make progress and be able to be safely held accountable by one another and to one another. And so what we did is we took our design sprint cohort experience, and Telespond's board of directors and the Wright Center for Community Health board of directors have come together in a nonprofit organization we're calling the Alliance, where there is equal representation of both boards of directors to continue to kind of workshop what collaborative opportunities lie ahead. There could be, opportunities like co-location, there could be build outs, there could be additional locations created, and to really figure out the sustainability plan together, because it's very difficult to ensure that the programs and services that you're providing to the community that they become reliant upon can survive. And we want to make them not just survive, we want them to thrive. So that platform of neutrality allowed us to build trust with one another. And so we're very proud that we have sort of redesigned bylaws, and we have committees created, and there is a task force coming together to workshop all of those sort of collaborative opportunities between the Wright Center's team and Joe's team over at Telespond and our respective boards. The goal is for us to continue working together to really create a regional geriatric center of excellence, which doesn't just have the Wright Center and Telespond as partners, but also obviously the Area Agency on Aging in Lackawanna County, and the United Way of Lackawanna and Wayne counties, and more social service agencies, because we're better together. So we intend for this vision to not just survive, but to thrive and grow. And we hope that we'll be able to invite other agencies into the organization. And again, next year we'll be talking about that success. Next slide. And I'm so thrilled that Joe Grilli is going to be talking to you next about our proudest moments before we turn it back to Eureka. Joe?
Thank you, Jen, for that wonderful summary of the last few months of our lives, so to speak. I'm going to summarize the process and from Telespond's perspective, and it may be repetitive in some ways to what Jen was saying, but I think it's important in terms of emphasis. As was mentioned, Telespond has a wonderful mission. and we've been providing, we've been a legacy of community. Let me start over. Telespond has a wonderful mission and a legacy of service to the community since 1974. For a variety of reasons, however, Telespond experienced market loss, high employee turnover, staff culture issues, and basically lost our client base, and our presence in the community eroded, unfortunately. But the community leaders recognized this, led by the Wright Center, the Area Agency on Aging, United Way, and a variety of other agencies to come together and appeal to a wonderful foundation called the L1 Foundation, who provided us the finances to continue to operate and figure out what we needed to do to get ourselves back on our feet during this very stressful time. In the meantime, we had a change in board leadership, a change in administration with not only myself, but about 70% of our leadership and management staff here. And then came along the design sprint exercise, which gave us the framework, as Jen mentioned, to work together toward a common goal. And you know, we wanted to leave the past in the past and move forward in the future positive manner. And I think we all decided at one point in the process, and maybe late spring, early summer, to say, you know, we're all going to put our skin in the game here. We're going to work together toward a common goal, and we all have a vested interest in the outcome, which is to create a center of excellence for Telespond and for the community. The idea here was sustainability, transform us from grant dependent to grant enhancement, and I think we'll continue to move forward in that vein. The design sprint, you know, really gave us the opportunity to get together. It forced us to meet, so to speak, in certain time periods, and really when it came to the point where we were midway through the process, we were looking forward to the meetings to say, hey, when are we getting together again? We got together on our own a few times to try to map out what we were going to do at the next meeting. And I'll tell you, it was a wonderful process from our perspective, and I hope from all of our community partners who collaborated with us. And for that, we thank you. New ideas are going to be generated. We're very, very excited from the board on down for our Hub Alliance. And in closing, a lot of work's been done, but we recognize at Telespond that there's a lot of work to do, but the design sprint has given us the framework to do so through the Alliance and through other measures they've given us. So again, we thank you from the bottom of our hearts. This was a wonderful process. Yuriko, I turn it over to you.
Great, thank you so much. It's so amazing to hear from Jen and from Joe in terms of the experience within the design sprint. As you can all hear and see, there was just a lot of great progress that was made. So thank you for taking the time to share your story. Like I said earlier, you all did an incredible job, and I really appreciate each of you for coming into this process, trusting it and trusting each other. So really just kudos again, and I can't wait to see how things evolve over the next year. So as we wrap up, we want to again thank the RWJF for their support in this program. And if you have any questions or you need more information, please feel free to email us at prepare@nac.org, and we'll be happy to address them. And be sure to stay connected and to join our listserv so you can stay updated on new resources and tools related to the social determinants of health and advancing health equity. Thank you, stay safe, and take care.